Well, welcome everybody to this panel discussion of program directors. I am pleased to present this with Zach, and I think really Zach has done the majority of the work for this program, and I say we need a big applause for all the work that he has done. I am trained as a urologic surgeon, and I've also been a program director in the past. However, things have changed. I do some assistance, although Dr. Sarl really is the primary one that's a program director here in the Sparrow Lansing region. So I'm welcoming him. Thank you so much. And I welcome all the other individuals who are program directors or associated with education, I should say postgraduate education in the students. And I think now it's time for us to introduce our speakers. Oh, and I should also add that I'm a SOSA faculty advisor. And so me and Zach have gotten to know each other pretty well over these last few months, especially with the COVID going on.
Thank you so much, Dr. Harding. My name is Kenna. I'm with OBEGS. Just want to thank everyone for being here tonight. So first up, we have Dr. Bose. You may recognize him from our female reproductive course. He's our course coordinator. He's also residency program director for the OB department with Metro Health in Grand Rapids. And we also have Dr. Jordan here. She's also our faculty through MSUCOM, and she's also an obstetrician and gynecologist. Past residency was at Providence, and then she went to MSUCOM for medical school. So thank you both for being here. Feel free to add anything else too that I might have missed.
So then next we will have Dr. Buckigo. He did his undergrad at Albion. He has a master's in public health, specializing in maternal and child health at University of Illinois at Chicago. He graduated MSUCOM at 2003. He did an emergency medicine residency at McLaren Oakland, and he's held some various faculty positions and program director in 2018 for the emergency medicine residency at McLaren Oakland. And he is currently on MSUCOM teaching mainly from the DMC campus.
My name is Zach. I'm the SOSA president for 2023. Soon it will be someone new for 2024. And thank you, Dr. Harding. She's great as the faculty advisor for SOSA. She's done a lot of great work for us, and this event really wouldn't have happened without her support. So thank you, Dr. Harding. We have two surgery-related program directors. The first is Dr. Susan Seaman. She is a fellow of the American College of Osteopathic Surgeons and a fellow of the American College of Surgeons, and she is the program director at DMC Sinai Grace. She's a graduate of the University of Osteopathic Medicine and Health Sciences at Des Moines, Iowa, although she went to undergrad at MSU. So she's board certified in general surgery and is a certified wound specialist from the American Board of Wound Management. She's a certified trauma surgeon and advanced trauma life support instructor. And then we have Dr. Richard Sarl, who is the Sparrow MSU Urology Program Director. He grew up in Vermont, went to college at Tufts University, and after that he obtained a public health degree with a focus on the relationship between cancer and hazardous waste sites. He attended the University of Vermont for medical school and then did his residency and oncology robotics fellowship at Henry Ford Hospital in Detroit. He was one of the first robotic fellowship trained surgeons in the United States. He was in private practice for 13 years in the Metro Detroit area, working with residents from Wayne State and DMC. And he left private practice 2 years ago to assist in forming the new Sparrow Urology practice. And with that, we're going to start with our questions. I think we can go in reverse order, maybe starting with Dr. Sarl and then going back up the list. And our first question is, how can students best prepare their applications especially in light of COVID interrupting a lot of the typical activities like away rotations and research? And sorry, Dr. Sarl, before you go, I should have done this first, but how we're gonna do this is we're gonna have a few basic questions and then we're gonna open up for the Q&A. So if you have questions, you can start submitting now in the Q&A and then we'll moderate those with the various program directors. Sorry, Dr. Sarl.
Yeah, I mean, I think students have had a very challenging time this year, organizing their rotations. The Society of Academic Urology did not allow people to rotate at programs outside their home institution if they had a urology program. What we did here at Sparrow is a lot of schools required outside rotation, so we were pretty flexible with people as long as their home institution allowed a rotation. I think that, with the modern communication tools, I think when in doubt, reach out to a program director and talk to them and ask them if you could just come, because in Michigan, I had several students that, live in Kalamazoo and asked me if they could come to Grand Rounds. And I see no reason why a student from Kalamazoo cannot come to Grand Rounds or even attend a Zoom Grand Rounds. All of our Grand Rounds are on Zoom now. As the program director, I always accept all the help Dr. Harding will give me because she is a great resource. But what I would say is that although MSU has hundreds of medical students, we don't have a lot of urology students rotating. And I hope to, and one of the reasons I wanted to participate is to reach out to all students and say, if you want to come on urology, we'd love to have you. Whether that's a day, a week, a month, or longer, we don't care. We'll take you. So I just think reaching out to program directors with questions is the best way to see what you might be able to come up with in terms of exposure to a subspecialty you may not otherwise get the chance to work in. That's what I would say.
Great, thank you. That's what I've done. That's how I was able to recruit some of the surgeons and other people who are on here tonight. So thank you. Dr. Seaman, do you have any thoughts about that? The problems that COVID have caused for applications and how you might overcome them for residency applications?
I agree. I think reaching out and, getting emails and people contacting us, I think it's great. It's a great way of doing it because I can't tell you how many times I get emails just for applying to the program. And I think reaching out, calling, instead of just an email, all of us are busy, but I find that I think it's a great way of communicating, and it just shows that the kids are really interested. And I also feel that they should not have fear about it. You know what I mean? This is a different time, and I think we're all adjusting, and it is what it is, and I think we can all make it happen. And besides, I think it's a little kindness in the world. If these kids reach out to us and we show them what to do and help them and allocate them the right direction, I think it's really important for us as leaders to do that.
Sure. So yeah, COVID has disrupted a lot of things, recently, including the traditional application and recruitment process. And I know that it's really screwed stuff up on our end from a residency program side of things. But we completely understand that the stakes are much higher, from your standpoint than from our standpoint. So we completely understand and appreciate the angst that everybody is feeling because no one has a lot of answers. This is completely unprecedented times. And I know specifically for emergency medicine, there's been wildly conflicting information and expectations from the emergency medicine organizations, ASAP and ACOEP, almost threatening that if you do more than one emergency medicine rotation, they'll be looked, down upon because it'll make you look selfish. To other programs and individual programs saying, no, it's okay to do multiple rotations. So we completely understand the conflicting messages that have been sent to you all. So really, from talking to a lot of other emergency medicine residency program directors, there's very little you can do during these times that we're going to look down upon. We're not going to hold you in any sort of negative light for any sort of behavior in terms of doing more rotations or less rotations. So don't think there's really anything you can do in terms of should I contact programs or not contact programs that you think is going to make us look unfavorably upon you. With that said, I can't emphasize enough also what the others have said about reaching out to programs. If there's a program you're really interested in, reach out to them. I know in emergency medicine my program had just over 750 applications for our 6 spots. And so I probably didn't even look at most of those. I had applications from Tulane and from UCLA, from students from all over the country who've never even been to Michigan. I know they really are not interested in my program. So we really relied on offering interview spots to students who rotated with us, but we also understand that not everyone who wanted to rotate with us, especially this past fall, were able to. So 2 is people who reach out to our program, specifically said, hey, I'm interested in your program. Then we would relook at their application and usually invite them to an interview. So yeah, I would recommend, if you are interested in a program, shoot the program director or the program coordinator an email. Say, hey, I'm really interested in your program, because that will have your application stand out.
I would just echo what people said already. And I think the key thing that I would say, even before COVID is, reach out and let people know of your interest. Like Dr. Bucky already said, you get lots and lots of applications. Many people are just clicking a button and throwing, something at the wall, hoping something sticks. And we always look first at people who have either auditioned or in some form or fashion reached out. If they couldn't audition, or we were full, or like this year we at Metro in Grand Rapids, we only took probably 25% of our normal number of auditioners. That was primarily related to a lot of things, but PPE was one of the key concerns. So if you're interested in someplace, let them know. Also, many places we did at Metro, opened up our education, our didactic time for students to be able to Zoom in if they wanted to. I tried to, through myself and through my coordinator, somebody reached out, connect them with our chief residents who were the ones working on the whole interview process and who we would look at. And they were communicating with them by email as well. So, and as Dr. Bucky already said, no one is going to hold you to the same, I don't know, let's say standards, but the same rules that we kind of followed, guidelines we followed before, because we know these are very difficult times. And it is quite variable from institution to institution. Some places will let you come shadow for a day or a weekend or something. A lot of places won't now because of liability issues and other things as well. But reach out, find out how you can become involved, see if you can attend a journal club or didactics when you can, and just make sure that the program directors know that you're interested.
I was reading though that some of the students are having troubles getting applications in because a lot of programs are cut back on their interviews. So they're asking people not to blast and apply to every single program you possibly can. Are the students having any troubles getting their applications in at all?
I'm only a second year, so I'm not sure. I do know that some of the systems were having problems early on, and they delayed. The cycle is a different length than it normally is, but I don't know the details as well on that. But maybe when we get into the Q&A, that might be something that comes up. We've already got a bunch of good questions. And so this question is, what are some ways to shine during third year when third year students are rotating through, OB or EM or surgery? How can students really stand out to impress, faculty at different programs and stuff like that?
Read one of your board review books before you come on my rotation. Say if you're doing general surgery, read on your step 1 or 2, read on that topic. Read before your cases, read nonstop. And then when you come into the operating room, you know the case, you read on the case, and make sure you're well prepared. And don't act like you don't know what's going on, because you should have signed that the night before. So frustrating. And if you want to become a surgeon, make sure you practice your tying, because we're going to put you right on there and say, make sure you know how to tie.
Yeah, Dr. Seaman, thanks for that. We've been trying to put together a suture clinic for SOSA this whole year, and I think we finally figured out a way to do it. So we're going to try to help students know how to tie when they get to the OR with you.
Yes, and I think it's also important, and I do this with my residents, starting for day 1. Tell them to do 500 ties on something. I don't care if you use yarn, use thread, whatever you do, just keep throwing ties, 500 a day, and use gloves when you do it. So when you step up to the operating theater, they know exactly the clumsiness with it, because they get so, they're like, oh my God, I didn't even know I could. This is so hard with gloves on. I'm like, next time practice with gloves. So I think that will help them, because it's like the biggest thing. I mean, you can teach anyone how to operate, honestly. It's really knowing when to operate.
All right, thanks, Dr. Seaman. Dr. Sarl, do you have any thoughts on that?
I really like that, what she just said about teaching surgery. I think you can teach anyone to be a surgeon. And I think that, and I would encourage students to not let someone else make decisions for you. I had a classmate in medical school who was on a surgery rotation, and someone yelled at him and he decided to do something different. But, that happens. And I think I think educators and people who work with medical students are nicer than they used to be. I hope so, because I think that in the past, there had been a I don't know, kind of a militaristic attitude about certain rotations. And I think that that's kind of gone by the wayside. You know, I welcome students. I think we can teach anyone to operate. And I think that that program director makes an excellent point. And I also think it's not the time to sit in the back of the room when you're on a rotation with 8 people or 10 people. You have to ask questions. You know, like I'm a prostate cancer person. It's not like that's a mystery. You know, if you read anything about what I do a lot of prostate cancer. So if you ask me a question about prostate cancer and you've done any reading at all, you look good. And it's that simple. Everybody you work with has a niche that they like, and doing a little homework about, you know, the people you're working with is relatively easy. You know, I always think it's impressive when a student asks me about a paper I wrote 20 years ago. I always think that that's a very funny thing, you know, that they took the time to look that up. Now, some people would say, oh, that's terrible. I don't think it is. I think, you know, it's about doing your homework. You know, these are job interviews. Obviously, there's an educational component, but the sad fact is these are job interviews. And I don't know what most of the students think. You know, the Society of Academic Urology came out and said they really think the Zoom interview process was wonderful. I thought it was horrible for students, because if I'm going to do a 5-year commitment, urology is 5 years, I want to go to that place and see what it's like and meet the people. And I would encourage, whether that's a rotation or a quick visit, I hope, you know, COVID does prevent those opportunities for students next year.
Great, thank you. So it sounds like for surgery, they want you to ask questions and read before the cases. It seems like that's important. Dr. Bucky, do you have an emergency medicine perspective for us?
Yes, I've got my 3-step process to shine during your clinical years. Step number 1, and the most important one, is do not be a pain in the butt. We in graduate medical education are very risk averse when it comes to choosing residents. One problem resident consumes an enormous amount of our time. And so if we know that you're going to be a problem resident, let me define. If you are struggling with medical knowledge, we can fix that. If you are struggling with application of knowledge, because becoming a resident when you're now accountable for applying the knowledge instead of as a student is a very big step. And sometimes people have trouble making that step. That's okay, we can fix that. But if you're a problem resident with professionalism, and you demonstrate problems during your student years of professionalism, meaning you're showing up late or not showing up on time or showing up unprepared, that's a problem. Or if you have interpersonal and communication issues. So if we hear that you were chewing out the cafeteria worker because they made your hamburger wrong, we will avoid you like the plague because you will consume an enormous amount of our time trying to remediate or clean up the messes that you make for the residency program. So if you demonstrate during your clinical years that you're a pain in the butt, you will be ostracized from getting residency spots. One of the guys in my class was actually on a surgical rotation, and he was an emergency medicine guy. And during the case, he asked if he could close when the case was over. And the surgeon said, no, you're a third-year medical student. You can help me, suture up. And advocating for himself, he said, I'm a third-year student at Michigan State. I pay a lot of money for my education. I think I should be able to close this case. So not only was he promptly kicked out of that OR, but he did not do a residency in the state of Michigan. So do not be a pain in the butt. So once you got that covered, the next thing to do, the next step in shining, is to make sure that you can, you approach your education with the mindset that it's your job to learn. It's not somebody else's job to teach you. Because there is money, especially when you're third and fourth year. Yes, you are paying Michigan State University tuition. The people who are training you are not seeing that money. So to think that you are entitled to an education, or rather they are entitled to provide you an education, is the wrong mindset. But if you can prove and demonstrate that you can learn from many, many different sources, you will look really good. In emergency medicine, if you ask the nurses to show you how to start IVs or to do procedures or to put in Foley catheters. In the OR, if you're getting good with the scrub techs and the surgical nurses, they will make your life wonderfully easier. And if you don't get any good with them, they will make you look silly. So show and demonstrate that as a learner, you can learn from multiple different sources. And the third and final step to shining during your clinical years is that you are always on audition. So when you're doing off-service residency or off-service rotations, we're watching you. Everybody's watching. We talk. Everyone in the hospital talks from the different programs. All the different residency program directors from across the state and region talk. And if you make yourself an outlier, either really good or really bad, we're going to know about it. So make sure on off-service rotations, even if it's a rotation that you're not interested in, make sure you work really hard, show up early, stay late, be polite, and demonstrate that you can learn from multiple sources. And if you do those three things, you'll do just fine.
Dr. Bose, you have the OB perspective?
So I would echo everything that was said already. And I think clearly when students come on service and they sit, it's our job to let them know what expectations are, but it's also the student's job to ask, how can I be of help? What can I do that would be useful here? And what are the expectations? And usually that's, in most cases, that's done with residents. If you're not working with residents or a hospital where there are not residents, then with the attending physician and or the nursing staff, if you're on, in our world, if you're on labor and delivery, which is kind of home base for OBGYN. Clearly, we look for fit, like Nick said. There's many students that are qualified from their academics, their medical knowledge. But if they come in and they're all about themselves and they act enabled and expect to be served on a golden platter and or are bumping their fellow students under the bus because they want to make themselves look good, that is not the way you're going to influence people and win friends. And so just be a team player, be a nice person. Yes, you can show your knowledge in an appropriate way, but don't do it by trying to show up your fellow students or first-year residents, which some students do. And like Dr. Bucky said, you are on audition 24/7. From the day you walk into that med ed office and you're working with the coordinator there throughout the hospital, you are observed. And if we hear or see negative things, it's not going to reflect well on you, particularly in this competitive world. We want to be there to help. We want to teach, but the residents are busy. And if they see a student sitting back in the corner and not stepping up, they don't have time to go hold your hand and pull you down the hall. So, try to be appropriate, try to ask questions at the appropriate time, and just be a good person. I will tell you that, and I'd be happy to share this document with you guys electronically afterwards as well, but there's an OBGYN document that really is applicable to any clerkship rotation that you do. And it just talks about do's and don'ts on a rotation. Do's and don'ts in the ER, do's and don'ts on ambulatory, do's and don'ts in surgery. And I think that's a helpful document to read. And I'll be happy to pass that back to the OBIGS folks and they can, and to Dr. Harding and Nick, I'm sorry, to Zach, to you, and it's freely accessible online. So I'll be happy to send that link.
I can add to that a little bit. I agree pretty much with everything I've heard, but in the OB world, or whether you're surgery, urology, whatever, I'd find out, I think that the senior residents have a lot to say about what students were like. So I would find out what time my resident was going to round, and I'd get there a few minutes before them. And whether that's, super early in the morning, I'd be there. I'd be knowledgeable about the patients. I know when labs were going to come back in, when any ultrasound, whatever was available, so that you could show that you took care of your patients well all during the day. So that would be my gin portion. Just if I know personally, I saw that in my training, that more was thrown your way and people liked you better when you were there and you really knew about your patients. And then up in the OB world, just like Dr. Bose said, you can go sit in the back room. Nobody's going to come looking for you, or you can hang out at the desk because there's long hours for ladies in labor. If there's a resident there, it's great. If it's a nursing only, befriend the nurses, show interest in the patients, even if it's a menial task. So I would really show myself off that way. And Dr. Butke mentioned about the scrub techs. They rule the roost a lot of times in the OR. So go in there and meet them. So that's my little additional take.
Can I add one thing, Zach?
Yeah, absolutely. Go for it.
Yeah, Dr. Bose mentioned the term fit, and that's very applicable, but I want to be very careful about what we mean by fit. And I think I can speak for all the program directors. We are not looking for any specific personality trait or characteristic or type of person that we want in our program. We want people who are going to work hard and want to learn. And that's the type of fit that we're looking for. So don't think that you need us to like you to fit in our program. You need us to realize that you're someone who wants to learn and work. I used the story a couple of years ago. I had 2 students on rotation with me. I loved a mountain bike and I love Northern Michigan. And so one of the guys that was rotating, one of the students that was rotating, was from Northern Michigan, and he loved a mountain bike. So we got along great. He was a likable guy, and he and I chatted up mountain biking, just about the entire month. At the exact same time on rotation, there was the female student rotating with us, who was one of the most annoying people I've ever met. She's one of those princesses who everything you said, she would redirect the attention back on her and say, no, here's why I'm even more interesting, and just a real personality type that I found very much annoying. And as the month went on, my princess was picking up patient after patient. She was picking up difficult patients. She was cleaning off carts. She was getting help learning from the nurses and really working her tail off. And my buddy spent a lot of time on the computer, looking up mountain bike stuff online. He'd be happy to share with me all the mountain bike stuff that he was finding online, during rotation. So guess who got the residency spot? The princess did, of course. So even though I'm not someone I particularly like, she's someone I wanted to train, and she's someone that I wanted to work with. So I just want to make sure that that's very clear, that we're not looking for any personality type or any type of person that we want to work with. We want to recruit people that want to work.
Great, thank you. Dr. Moyer-Breland, do you have any thoughts on that?
Nope, you're running out of time. I think everybody did a good job.
Okay, perfect. So we're going to have our last question of the structured time, and then we're going to go into a Q&A after that. And actually, one of the first, this question that is our last structured question was actually asked in the Q&A. So I'll ask it as we said it, and then I'll also ask it from the Q&A, which is, so for the class of, this is for the class of 2024 especially. What are your thoughts on pass-fail boards for both COMLEX and STEP? And then the question from Q&A was, with Step 1 and COMLEX 1 becoming pass-fail for the class of 2024 and beyond, what are your thoughts on what could fill that gap in residency applications? And it's okay, this might be very different for different specialties. So however you all want to answer this, don't worry about disagreeing with each other. Dr. Sarl, do you want to start?
Sure. I've never been a big fan of the importance of Step 1, be end all and be all. I have seen the highest scoring, 260 people be the worst rotating student you have ever met. So I'm probably in the minority. I'm kind of glad that they're focusing less on these scores and using them in these ways. That's my, personal opinion. Urology is a fairly competitive subspecialty. I mean, we got, I think, about 155 applications for 2 spots. So it's pretty competitive. And, I'll be very honest with you, a lot of people use straight board cutoffs, and I'm glad they're not going to be able to do that. I do think program directors will probably start using the next STEP exam as the next cutoff, but maybe we'll be actually forced to read more applications. I personally read every single essay for every single applicant that applied to our program. So, and I always pick about 5 or 6 interview just because of their essay, as long as their application doesn't have any, bodies in the closet. I think that giving people a chance in the absence of, data like a Step 1 score, I think it's a good thing. And so that's kind of my perspective on it.
Great. Dr. Seaman, what is your perspective on pass-fail boards?
My best residents that I've graduated from my program actually failed their boards, meaning prior to meeting me. And I met them, and I was kind of like I am a little bleeding soul. And they are the best residents I've ever had. And then I have residents that are top notch, highest score. And personally, being an osteopath, they don't have the best bedside manner. And an inner city hospital people, you really need, inner city people really want to believe in you and trust you. And if you cannot communicate with them, you're going to go down a very dark hole. So I have mixed feelings because as a program director, the ones that are doing poorly, it exponentially creates a lot of work for me and my colleagues because we have to mediate them. We have to work with them. It's just a lot of work. As I tell my children who only have one job and I have 7, and it's same with students. They're normally not married and have kids. I said, you have one job. You just got to take care of yourself and study. And that's all you have to do is work on you. Oh, my daughter's coming in. Sorry. So I do have mixed feelings. I do feel that it's very important to study and to do the best you can and leave the rest to God. So I am conflicted with it. But now, now I say, let's do a lot of research and that'll get you in. But now with COVID, it's really hard to do a lot of research. So I have mixed feelings. But at the end of the day, I think when you meet somebody and you meet them and interview them, and you look at the personal statement, I agree with you. I read every one of my personal statements. I feel that composes a lot of integrity with individual. And their letters of recommendation. A letter of recommendations is 3 lines versus a couple pages does say that a lot about that individual.
Great, thank you. Dr. Moyer-Breland, you normally go last. I think maybe we can give you a chance now so that you can get a good answer in before someone else.
Pass fail is about time. I mean, it's not about your scores. You're all at the top of your class. Is why you're sitting here and watching this Celebrity Squares panel here. Yeah, the idea that everybody's passed. I mean, you've got the minimal. I mean, that's what boards are anyway. When you take your boards, is pass fail. So why scores in school? I don't understand. So it's a good thing, I think, and I don't think and you can just listen to what everybody else is saying. I don't think people hold a whole lot of weight to scores other than just boasting.
Dr. Bucky, do you have any thoughts on that?
Yeah, you guys have a lot of things to worry and stress about. This should not be one of them. It is every year for the last eternity when the USMLE, or the AOA boards send us the board scores. They send us a letter saying you should not use board scores to evaluate residents. The only thing that boards are good for is determining a minimum competency in medical knowledge. So anything more than a passing score does not prove anything. So every year they send us that letter, and every year they report out the board scores for us to look at. So I'm glad they're finally, following their own advice and not giving us those scores to look at, because a higher score really doesn't mean anything other than you achieve minimum competency. So I would pick something else to stress about. That shouldn't be one of them.
What about you, Dr. Bose?
I totally concur with what's being said here so far. I've never been a big fan of looking just at board scores, and I haven't. I do have a very low cut score, and I look a little bit more at boards for individuals who did not rotate, only because I don't want to invite people to interview that I feel may not be successful. But I think that of all the things that are important, board scores are, as has already been stated in a number of different ways, are not, except to show that you can meet that minimum standard of passing. So if you get what I would clearly say is don't blow off boards just because now it's going to be pass fail. You do not want to fail your boards. You want to pass because otherwise you're going to be climbing uphill with all the competition you have to say why you failed the board. So don't blow it off, take it seriously. But I totally agree that it's not a good marker. And we've all seen, as Dr. Sarl said, people who have very high board scores and are not good clinicians when it comes to patient-to-patient contact, and vice versa. I think that there's a couple of things that Dr. Seaman said, and I can't remember what they were now, that I wanted to mention. But I know the letters of recommendation for one. When you're choosing who's going to write your letter, try to be careful who you choose. Ideally, a program director wants to see a letter from somebody who is in the business of training residents. And those people generally know what program directors are looking for, and they're not just going to say nice things like, Susie dressed very nicely. She was polite to my patients. My patients loved her. That's all good stuff. But you need to know a little bit more beyond that. And people who are in the business of training residents have a little better understanding of that. So that's important. And your personal statement, try to let the reader know what's unique about you, what stands out about you. And if you're attracted to urology or general surgery or OB or ED or whatever it is, why you're pointing in that direction. I do also read the personal statements. I spend a lot of time doing that. Ideally, we historically have liked to have a lot of auditioners so we can really look at them for a month or at least 2 weeks, but that's not always possible. So I would just take collectively everything everybody said and try to register that. I would also point out to the students right now, in case it doesn't come up later, you can go to the national NBMS, I think it is. They have all the data in there about different programs, what their cut rates are, or what the average board scores were, and other information. They also have surveys in there of program directors to say, what are the most important things that you look at in terms of inviting somebody to interview? And then the same survey in a different vein for those you interviewed, what are the most important points that you look at to rank that person highly? You'd be surprised. There's quite a variance in there, but it gives you some idea about what programs are looking for. And when you're applying to a program, also I would say, look at the program. If you want to go to the Harvard or Yale, or I'm using those names because they're Ivy League-ish, but some place that's never taken a DO, for instance, we're talking DOs here tonight, and have so many applicants that you're not really going to stand out. And then unless you really have something to sell yourself on, don't apply to those kind of programs. Be realistic in your expectations about the programs you're applying to, and look and see who the candidates are that they've taken in the past.
All right, great. So we targeted 7:40 to start our Q&A, and we almost made it. We're going to try to fly through as much of the questions that came into the Q&A as possible. We might not make it. If you need to leave at 8, that's totally okay, and that's true for the panelists and for the attendees. But if you're willing to stay, we can do a few more questions after 8 as well. But we're really going to try to fly through. Thank you so much for all the great answers so far.
So one of the questions, we can start with Dr. Bucky, since I'm associated with EMC. It is, since both USMLE and COMLEX are both pass-fail, or will be both pass-fail, will DO students need to take both in order to be competitive for residency? And I know that's a question I have also, because if you reach out to people, some will say, yes, absolutely take both. Some people will say, just take COMLEX as a DO, and some people, have no opinion at all. Do you have any thoughts on that?
I do have thoughts, but unfortunately, I don't know how predictive they're going to be. My own personal opinion, for my program is it doesn't matter. I'll take either and I'll accept either. So if I have a DO student who took COMLEX and USMLE, I will treat them exactly the same as someone who just took COMLEX. And obviously the MD students can't take COMLEX, so I just look at the USMLE. So my advice up to this point has been, if you're an MSUCOM student and you know that you want to stay within the statewide campus system hospitals, you don't need to take the USMLE. We know the COMLEX, we're all comfortable with the COMLEX. We know what to do with that. I wouldn't waste your time and money. If you want to get out of the state of Michigan and do a residency, even though every residency in the country is required to accept COMLEX or USMLE, a lot of the programs don't know what to do with COMLEX scores. So they will give you, you'll be at a competitive disadvantage. So if you plan on going out of the state of Michigan, I would recommend taking USMLE. Is that going to hold true over the next couple of years? I don't know, but that's my advice for the time being.
I think if you're applying to strong DO, if you're looking at legacy, if you will, DO programs, and or in states where DOs have had a stronghold, and that would be like Ohio, Pennsylvania, Michigan, perhaps New York in certain areas, then people are much more familiar with COMLEX. I have a brother who is a MD in Columbus, Ohio, at a large medical center. He's internal medicine. I think they take like 24 residents or something, a large number of residents per year in internal medicine. And he historically has always looked at DOs and MDs, and therefore COMLEX and USMLE. This is all prior to the ACGME single accreditation system. But if you're looking in Utah or Colorado or someplace that they're not as familiar, then I think it's more critical. It kind of goes back to what I was saying earlier. If you can project ahead and you're looking at places, or you think you might be going, out of state, like Dr. Bucky said, particularly to states have not had a high DO prevalence or a high, or have had training programs in that state, then you're probably better served to do USMLE as well.
Great.
I can add one more thing here. The other thing is, if you're a glutton for punishment, take them both. You're studying for one, you're studying for two. So if you're going to be applying outside in a program you're not really familiar with, or may not be familiar with you, take them both. If you can afford it and you can, the time and the pain of taking the dumb exam, you've already studied for one, you've got them both. So it's going to be hard to go back and study for it later.
Great. So this next question I'll direct at Dr. Seaman because it applies to my relationship with Dr. Seaman. The question is, what advice do you have for first years who want to reach out to programs in the state to start building relationships? Is this too soon and will it be well received? So I'll answer this question a little bit. I met Dr. Seaman in like August of my first year of medical school, and we have published research together. I know all of her residents and I do research with her residents. So in my opinion, and I think Dr. Seaman's, unless she thinks I'm annoying, I think that the answer is it will be well received. But Dr. Seaman, please answer that question. So do you think it's good for first years to reach out?
Absolutely. Absolutely. It shows that you have integrity, pursuance. It makes you stand out well beyond anyone else. So I do not find that that's annoying. First of all, you're not annoying. You have made me so much appreciate, and you've taught me so much about research, and I really, really appreciate that. And you have, honest to God, Zach, I'm not just blowing shit up your ass, but you really are such a good kid. You fought for our military. I mean, you stand behind everything that you do. And I so appreciate you. I talk about you all the time. And God, if most medical students were like you, we'd be so gifted. And you fight for our country, for God's sakes. You really, really have helped us and helped me and helped my program. All my residents know you, and you've really contributed a lot. And you have to, and really, you should be commended for that.
Thank you.
And I also definitely think, especially my program, you should definitely take both, because we have a lot of allopaths and they don't even understand what a DO is. So you definitely should take USMLE. And I agree with the other physician. I just forgot his name. I'm so sorry. Definitely take both. Gluttony for punishment, do both, because you don't know where you're going to end up at the end of the day. You just don't. So don't cut your bridges. I think it's important to take both.
Great, thank you. And thank you for the kind words. Do any of the other program directors have any thoughts on first years reaching out early on in their first year?
I say the sooner the better. When we had an applicant this year, when I interviewed her, she told me she sent emails to, urologists throughout the country who are top in their fields in research. And she got 4 major publications at institutions that have never taken a DO applicant. So, and I think you just have to put yourself out there with email. And most program directors are very willing to talk to a student. And so I would encourage exactly what the Dr. Seaman just said. I think that reaching out is crucial. And if someone, doesn't respond as positively as we're talking about, well, that's their problem. That's what I would tell you.
Absolutely. And you don't want to be associated with individuals that are like that. You want to be with a program that institutes positivity, because so many people are negative. Have you guys ever noticed, like, a student will come to you, say, I want to become a surgeon, and they're like, oh, don't do it. And you get so much negativity. I'm so tired of people being negative against our profession. It's the greatest profession in the world. You really do help people. You can do so many different subspecialties. It is such an amazing profession. And I say to those kids, people are being negative, screw them, move on, go to someone else that's going to be positive.
Okay, we have another question in the chat. I think it's been on here twice. MSUCOM is a school that does class rank based on our grades within each course that we take. So this question is asking how important is class rank in regards to other parts of our application, like personal statement, complex or step scores, things like that. Anyone can feel free to answer this one as well.
I think it's right up there with board scores.
I think it's very variable what different program directors will look at. So as was stated, you don't know where you're going to end up. But I think that as best as you can judge, you need to look at that and see what's important for that particular program. Everything is a piece of the wheel, if you will. And if you struggle academically with grades, maybe that's an area that you want to address in a way that in your personal statement that says, I know that my grade scores don't place me at the top of my class, but I have a strong work ethic. I found that I do well. As you get into clinical rotations, you get positive feedback. You can use that as a source of selling yourself as well.
Yeah, I think screw them, be positive is going to be my motto from now on. I love that. But I'm not a big fan of the class ranking. I just think it breeds unnecessary competition and conflict amongst your peers who should be supportive and uplifting. And same with the boards. I wouldn't put a whole lot of value in your class rank. If you pass medical school, I know you're a solid student. So where you fit with other people, it doesn't make a difference to me.
So I would agree with all that, but understand that you have 1, 2, 3, 4, 5, or 6 different people that have either been program directors here or are program directors, and not everyone thinks the same way. There are some places that put a very high value on board scores and class rank. So that's why I emphasize to look at the programs that you're looking at. And if that's a strong component, you have to decide, am I going to be competitive in that program or not?
So here's a question. Sorry if I cut anyone off. How do you view applicants who have failed a class? Would you factor COVID into this? And this is open for anyone to answer.
It is not a deal killer for me. If you failed a class, or even if you failed the boards, it does warrant explanation. And it's certainly something I'd be interested to see how you respond and reply. The wrong answer is to externalize and say, oh, it was COVID, or the class was unfair, or I really didn't understand the material, but I'm a bad test taker. If you start externalizing blame, then it's going to be a turnoff. But I'll say this, because right now, the most important things in your life are passing tests and passing courses. And if you have a failure in that, the stakes are very, very high for you. And keeping things relative in perspective, in a few years, you're going to be a physician. And if you make a mistake because there's something you should have known, but you didn't know, or you made a misjudgment, or something goes wrong because of your decisions, somebody's going to die. And I think I can speak for all of the panels here. We've all made a mistake. We've all done something. We should have known something we didn't, or we made a misjudgment and someone was harmed or someone was killed because of it. So in a couple of years, the stakes get a lot higher when you make mistakes. So I use that if someone failed a course or if they failed the board exam as an insight to your character and see how you responded. If you take accountability for it, if you said, you know what, I messed up, I didn't study hard enough, I wasn't prepared, and I turned around and studied even harder. I threw myself a little pity party, I cried, I weeped, and then I pulled myself up by my bootstraps and I worked even harder. That's the right answer. That's what I want to see, because you're going to make more mistakes in your future when the stakes are, believe it or not, much higher. And I want to see how you respond to those.
I was just going to say, I would agree with Nick, and just to echo that, resiliency is overcoming an obstacle and showing how you did that. So don't try to bury it. If you have something in your profile, it's better to address it and say, this is what happened. This is how I addressed it. I'm taking ownership, and I moved on.
I was just going to add, I have written a number of letters of recommendation for residency positions in the surgical specialties for MSUCOM students. And when there is something like that, that they failed a course or something that makes their application look poor, is so important that that be explained. Sometimes when they do explain, it was a horrific time in their life, and it's amazing they did as well as they did. That makes a huge difference.
I just wanted to mention that I put 3 links. Trish O'Brien asked a question and I put 3 links. The first link is the program director's survey, where program directors answer questions about what they look for. The second one is Frida, which is like a residency program explorer. And then the third one is charting outcomes specifically for osteopathic students. If you want to look at those links, feel free. And then our next question is, to follow up on the pass-fail question that was answered live, do you think that that means that what quintile you're in will be of very high importance, or just one of many factors? So for people who might not know this, MSUCOM has quintiles. We're broken down into 5 different quintiles from the, quintile 5 is the highest scoring and quintile 1 is the lowest scoring.
Most schools have either quintiles or quartiles that I've seen. And again, I would say it is what I think you said, Zach, is it's one of many components. And I don't mean to sound like a broken record, but it really depends on the program. Some programs have, particularly the larger programs, have complex formulas that they plug data into. And if A plus B plus C doesn't equal X, then they don't get looked at. And that can be anything from board scores to, did they do research, to what quartile are they in, their personal statement. So they have objective ways in their minds, at least, of looking at it and compiling a score and determining if they're going to interview that person or not.
We'll keep rolling with the questions. This question is, maybe Dr. Sarl could answer this because he has a smaller program than the other ones. What do you suggest for people who want to go into a residency that has fewer programs available or less available seats overall?
The webinar will begin shortly.
I think if you're trying to get into a smaller residency, once again, all the things that we've talked about already are important. I think doing a rotation where you want to go is probably the single biggest predictor of getting into a place that you might not have gotten into if you just applied like an applicant and never went there. It's your opportunity to get a job. Think about how people get jobs. If you look at the people who have matched in our program, most of them have been rotating students, especially with Zoom interviews. I'm much more apt to, give someone a chance who's been with me for a month or even 2 weeks than I would if somebody applies, even if they're a good candidate. Going back to your previous question about scores and things, I look at the clinical rotations as probably the most important thing. I like a student may not be in the top quartile, but if they honored every rotation, even if they passed all their other classes, I always think that's the diamond in the rough. And that's really what you're trying to look for. At least that's what I try to look for as a program director. Once again, rotating is very important, and reaching out to the smaller programs. There aren't that many medical students that want to be urologists. It's a number. But we have a few number of spots, and so that's why I think reaching out and talking to as many people in the specialty as possible is helpful for you.
I have a question about that I think is important. Is it possible for us to reach out to any of the panelists?
Yes, to me.
Absolutely.
I don't think we could see it any more than we all have said it.
Okay, well, if it's unanimous, then I'll put together a list of emails and we'll make sure that those are available to everyone. Okay, this is a follow-up to a question kind of that we had talked about a little bit earlier. And this one is, rather than can they reach out, but how can first years get involved when reaching out to residency program directors? I would love to get involved, but I'm not sure what can be expected of a first year at this point.
I think that research has been definitely one of the biggest qualifiers, especially for osteopathic programs. So I feel that if you can contribute to research, I think that would be very, very beneficial to them. If they can assist in our research, I'm not sure, depends on where they live, of course. As you know, you've helped me immensely with research, and don't worry, after this call, I have to tell you, you're going to help me more. But I think that just, in order to help affiliate, expedite it, because, as a lot of these studies, you know, they require so much manpower and you have to pay for things and you have to get grants. And like our Tylenol study that we're going to do, I'm just using all my residents. And if medical students want to help gather data, I think that would really be beneficial.
So here's a question from someone, since we're bridging the gap here. How do program directors view students who may have had criminal issues in the past?
Well, I think that's a big depends, right? What kind of criminal issue? Were you storming the Capitol building, or were you, jaywalking? Yeah, I know that's being funny, but it really does depend, like everything else we've said.
Right? If you were 18 years old and you got a minor in possession, or you got a DUI, and then you can show that nothing has happened since that time, and maybe even address that, here's a positive way that I address that, then I think that is would be in your favor. I think like Todd said, it really is. It depends on the situation.
Yeah, it's not necessarily a deal killer, but it certainly warrants explanation. And we would be very interested in your explanation. Again, if you start externalizing the blame, say, well, it's someone else's fault because even though I was drunk, the cop shouldn't have pulled me over. Okay, well, that's someone who's going to continue to externalize their problems, and they're going to be a problem for me. So that shows me a lack of insight. But if you made a mistake in the past and you acknowledge it and you're accountable for it and you state how you're correcting that, it's not a deal killer.
Cool, thank you for that. So another question is, what is the most important thing that students can do in interviews to stand out?
Be yourself. We can see through you.
I would avoid reading a prepared statement. I had 2 people do that this year. Reading a prepared statement is not recommended. It's not the news. It's supposed to be a conversation, and be yourself, and if, I think that's really the take-home message. Having done, I think we did, 25 Zoom interviews this year. And so be yourself and, have something to say though, because a lot of times, sometimes it's just like dead air. That's the other thing that I would say is not good in an interview, saying nothing. Have something to talk about, don't care what it is. Have something to say.
Also, I would say do your homework ahead of time for the specific program. I've seen cut and pasted personal statements that they have the wrong program or city in their personal statement, and I appreciate trying to personalize it, but if you're going to personalize it that way, and I think it's a good idea, just be very cautious about that. And for programs, when you're going there, find out something about the program and ask a question about it, or something that shows that you actually, just like in any job interview, like Dr. Sparrow said earlier, I think you need to know the turf and show you prepared for this, and then discuss in a proactive way what you can bring to the table to help to enhance the strength and community of the residency program.
Yeah, my advice is, one, be sincere, be genuine. You don't know what we're looking for, and so you just present yourself and be sincere. The second thing is ask questions, and even if they're difficult questions, even if they're, what's the weakest part of your program, or what do you think needs to be improved in your program, or if it's something specific to the program. Oh, I hear Pontiac is a pretty unsafe town. Is there somewhere safe for my family to live? Come up with questions, so when we're interviewing you, you're not just like, yeah, whatever, we'll come there, sure. So it looks like you have a vested interest, and you're interviewing us just as much as we're interviewing you.
That kind of ties into the next question from the chat, or from the Q&A rather, which is, do you have any advice for writing a personal statement when writing is your worst subject?
It sounds like I'm in the minority of this group, but the personal statement has very little value for me. I really don't put a lot of weight in the personal statement because I don't really care how good of a writer you are. I know it's been read and proofread and proofread and proofread, and so it's very polished. And I want to see when you're unpolished. So personally, I don't put a lot of value in the personal statement, but obviously that's not the norm.
No,
Well-
I'm glad we have some disagreement between program directors because I didn't want to just have the same answers, and I know it's different from program to program. So Dr. Bose, please.
Yeah, when I read the personal statement, I understand what Nick is saying, but I try to use that to, I do individualize my interviews, and I prepare ahead of time, and I look at their personal statement, I look at their volunteerism and service, but I also look at, did they ever hold a job? Did they ever have a boss? Did they ever have to answer to an HR department? A lot of students coming in have never held a job. They don't understand that this is a job. They're not just entitled students paying tuition. And there's lots of factors that go into it. So I will ask them, tell me about this, or tell me about this experience. So if there's something in the personal statement that draws me in, then I'm going to ask about that during the interview.
I had a personal statement this year from a guy who was a medic in Afghanistan. You want to read a story, that's impressive about an experience this person had, so I think I can pull out the 3 personal statements that I've read that are, impressive. I had another personal statement of a family who, fled another country from, persecution, and one of their family members was killed. So a personal statement, can be about your, rotation on a summer research project, or it can be something unique to you. And I think that that's your opportunity to put that on paper, because it's hard to put on you can put on your CV that you're a veteran or that you've had, experiences serving in our country, but talking about that experience in your personal statement, it's a real opportunity to reveal something about yourself that you really can't put on a resume.
I absolutely agree. I have to tell you, I have read some statements that literally choked me up. One of the resident I have right now, who's a rock star, he was a football. He was his captain of his football, and I read his personal statement, and he had done this amazing amount of research, and he really choked me up. He came from nothing, and I was so enamored by him. And Dr. Barnwell had made a comment. He's like, do you realize Dr. Seaman has never acted this way? I'm telling you, people should be commended for what they do in life and their dedication and their commitment. And, you learn so much, and you take those experiences and you don't use it as a negative, but you use it as a positive, and you create your well-being to make you the best you can and to help people. I think that says a lot. And honestly, I don't really look at the grammar, because I asked Zach, I barely speak very well. I always say English is my second language. I didn't do very well in English, but I know what my point is and I know how to tell people. But when it came to writing, I wasn't very well. But it wasn't really how well they wrote it, but just what they went through to get where they're at. I think that's so amazing. And I think we want kids that are normal, kids that are kind. It does, as Dr. Taylor told me today, he would tell his residents, it doesn't cost any money to be kind. Just be kind, because it will get you further in life than being an asshole. And as ER docs, those poor guys, they get so much grief from us. And it's really a true statement, just be kind and just work hard. And, as my dad say, you work hard plus 10%, you're going to get what you need, and people will be kind to you.
I think the next question is going to be our last question, and then we're going to wrap it up. But so for our last question, someone had a question about information about managing finances for residents and money management programs, obviously with debt being very high after medical school and residents don't make that much money. Any thoughts on that for your various programs?
I've actually given multiple talks at residency programs about this topic, and the one thing I would recommend for every, student to do is to go to the White Coat Investor website and listen to everything that guy has to say. And then there's another one called The Physician Philosopher, and he has a thing called Medical Degree to Financially Free. I think it should be required curriculum for all students. It's wonderful stuff. And, we have the opportunity in medicine to make a good living, but the debt that you guys are all put under to get to this process oftentimes is paralyzing. And these two resources are very helpful to that. You know, unfortunately, when you get your first job, you have to live like a resident for 3 to 5 more years, depending on how much debt you have. And if you're lucky enough to not have debt, well, good for you. You don't have to worry as much.
I'm actually going to put a plug in here for ACOS. So obviously I'm the SOSA president, and we're changing our name to a different name, but it's related to ACOS, which is the American College of Osteopathic Surgeons. And this year at the conference, the person who runs the White Coat Investor website, Dr. Dahl, I think is his name, he came and spoke, and you can actually access that if you can access the YouTube video of that through ACOS. So if you're not an ACOS member, you should be an ACOS member so that you can get access to the talk about managing finances as a medical student.
Also do David Ramsey. It's cost $12.99 on your phone. Also goes through, like, I think it's 12 different ways of how to get rid of debt and become financially sound. It has sound advice. I highly suggest, as a matter of fact, I make all my interns and residents also do it. Part of my third Tuesday of the month of how to like run a business, teach finance. Another great iPod, you can listen to it in your car, and it just goes through everything of how to get rid of your debt. I highly recommend that. It's like $12.99.
Yeah, I drove my wife's old Nissan Xterra for my first 3 years as an attending, which is the girliest car around, but it was financially a very good move.
I had an attending that told me right off the bat not to go to buy the big house and the big boat. Save your money, pay your debt, have the cash to pay for it, and you'd be better off. And the other thing I tell my kids is I put $2,000 in the IRA as a resident, and the next thing I knew, it was worth like $80,000. So even though you're kind of broke, try to shove a little bit of money into someplace, you know, Roth IRA or something like that.
Right, absolutely. And Robinhood, it's an app that you put down, you put through, and you can invest. It's kind of like doing it's kind of like gambling, really, but no, but same concept. Absolutely. And I did the same thing with my children. They can start now. As soon as they turn 18, they can put into their Roth IRA. You can't do it when you're a minor, but same thing with Robinhood. Very important.
Anyone can contribute to a Roth IRA if they have earned income, including a 6-year-old, just so you know. Because if you listen to the White Coat Investor, his child does the disclaimer at the end of the thing. And the reason she does that is so she can contribute to her retirement. And she's 7. So it's very interesting stuff.
So what you're saying is his 7-year-old child has more money than we do. That's good to know.
You are a medical student. You are broke, right? I think so.
Most of us are. That's true. So thank you so much to everyone who came to speak.